Welcome back. You're watching 5 Talk Street. I'm Mark Fine, and we're here now with Dr. James Mackey, who's the board-certified internist and oncologist with Choice Cancer Care. And James, welcome. Appreciate you being here.
Thank you. Glad to be here.
Let's talk a little bit about screening for people who could potentially be suffering from lung cancer. Getting screened is just so important.
It really is. Lung cancer is a very serious problem in the United States, and it's estimated that there will be over 160,000 deaths from lung cancer this year alone.
Wow. And
usually when it's found, it's in a very advanced stage because symptoms usually don't appear until it is actually pretty far advanced.
Right. So, you know, we talk about getting screened. The medical world now, as a whole, things change so fast, and we're doing so much better, and people are getting, people are being healed and living longer. Here, this is no different. This is another area where the technology keeps advancing. What's different now? What's the newer things that's allowing you to get people to get it recognized quicker and to give them a chance to survive?
Well, the newest piece of information that we have was a clinical trial called the National Lung Screening Study. And what they did is they had 50,000 people who had no symptoms of lung cancer, but they were at risk. So they were people who had smoked at least 1 pack per day for 30 years or the equivalent of that. And they either got a chest x-ray once a year for 3 years or a CAT scan of the chest once a year for 3 years. And what they found over the 7 years of that study was that there was a 20% difference in survival. And the people who got the CT lived longer.
Unbelievable. So that's obviously a huge difference. So now what you're trying to do is get more people to go get these CAT scans.
Exactly. So that information came out towards the middle of last year. Wow. And we have put together a lung cancer screening program at Choice Cancer Care that we're excited to share with the community.
All right, tell us a little bit about that program.
Well, the program is hosted on Saturdays. It's usually the second Saturday of every month. If anyone is interested, they can call the main number at 214-379-2700. And usually be on a Saturday morning. It's only $30 in order to get the scan. It's done without any IV contrast. It only takes a few minutes. I will meet with each of the individuals before the scan is performed and ask if they have any questions. Sometimes they don't, and we can talk about whatever they want, as time allows.
Right.
But yeah, they get the scan, and it's over very quickly, and they're on their way.
And the numbers that really jump out at you here is the difference in catching it early. So for $30, if you're at risk, you go get this test. It's a huge difference in if you do catch it early and the chance of surviving, right?
It really is, because lung cancer is one of the more difficult cancers to treat. It's very resistant to chemotherapy and other treatments that we have. So it's best if you can catch it when it's very small and you have more treatment options available.
What else do you want to tell people about dealing with the potential for lung cancer in terms of trying to prevent it and stay away from it?
Well, I think the obvious answer is to definitely stop smoking, because that is the direct cause of about 90% of lung cancer cases. And I know that it's very difficult, but because lung cancer is so serious, it's worth really making an effort to do that.
You say stop smoking. There may be people who didn't smoke for long, smoked for a number of years and then quit. By the same token, if they did smoke, they're probably in that act. Even if you've stopped, my point being, you still probably want to get checked out.
Right. So even if somebody stops smoking, the risk does decrease over time, but they're still going to be at an increased risk compared to somebody who has never smoked.
All right. Tell us again the basics of this program. We know now the CAT scans are more effective than the x-rays, and you guys are trying to provide those for more people.
Right. So if someone's interested, they call, they get scheduled, we'll do the scan. The scan will actually be read by a radiologist that we have arrangements with to read these. Then we'll usually get the report within 1 or 2 business days, and then I'll call the patient back and inform them of the result. Sometimes they'll have a primary physician that they want to receive it. We can send them a copy, and we'll just do whatever the patient wants.
All right, and you try to do it on the second Saturday of every month, right?
Right.
All right, and again, just $30 and a chance that that you can survive this horrible disease goes way up.
It's really an incredible offer, an incredible deal, and we're doing it as a service to the community.
All right, Dr. Mackey, thanks so much for being here.
All right.
From Choice Cancer Care.
Thank you very much.
Appreciate it. All right, don't go away. 5 Talk Street is going to be right back.